Hi, Dr. LeClair.
Dr. Young, nice to meet you.
It's nice to have you in today.
It's nice to be here. I just want to take this chance to thank you for this opportunity as well.
Of course. Do you have any problem with me, referring to you as Nick?
No, Nick's perfectly fine.
Okay. And you can just call me Kevin if you would
Sounds
like.
good.
So let's just start off. Why don't you tell me a little bit about yourself?
Yeah, okay. So I graduated from Ithaca College with a doctorate in physical therapy, and my minor's in sport and exercise psychology. I'm from a small farming town in about central New York. Excuse me. I got into physical therapy, and going into college, I was just one day in high school looking at different majors. I knew I always wanted to be in the medical field. I just wasn't exactly sure. So I did some research on physical therapy and saw that there was a close program in Ithaca, which was about 45 minutes away from my house, and it was a really good program. So I, enrolled in it. And then freshman year, I actually needed physical therapy because I broke both my wrists, and it all kind of exploded from there. The first time I ever worked in a clinic, I knew, this is what I want to do for the rest of my life. And I have a real true passion for physical therapy.
Okay. It's great that you found the profession of physical therapy, and even though you sustained an injury to both of your wrists, it's great that you were able to actually, go through it firsthand for yourself.
Mm-hmm.
But other than that, so why don't you tell me some things, some of your strengths and also some of your weaknesses?
So a few of my strengths is, like I said before, I'm passionate about physical therapy. The one thing I always knew I wanted to do was help people, and it's an easy thing to do in physical therapy. I say easy, not in anyone can do it, but easy as it doesn't take much to try, to alter that person's day. Through the different internships I've done, I've just become more and more passionate about the field, whether, just expanding my horizons, seeing patients with every kind of disability or disease or impairment, just to kind of get a wide knowledge base. Which is my second strength, is I'm just eager to learn. I don't want to stop learning something at all, especially in regards to that major. My major, I should say. I want to know everything that I can about it, because that's the only way I'm going to become a better clinician. So, try to stay open-minded. Reading research studies, I try to see where they're coming from, why they're coming from it, and, just try to take any opportunity I could see. A few of my weaknesses is, obviously, I'm just coming out of school. So right now, things are just going to be different for me. It's going to be the first job in physical therapy. The weight's entirely on me. At clinicals, it was on the CI's shoulders, but you still had to kind of feel what it was like. So I'm not used to that kind of environment of being a full-time physical therapist, where all the documentation, scheduling is all based on you. And the other thing is, this clinic being in Oregon, it is a long kind of drive out here, kind of picking up my life and going out to Oregon, but it is something I'm also absolutely willing to do, try something different. Never been out here on the West Coast, this whole environment was new to me, so, it was just something I wanted to see.
Yeah, definitely, like with any new job, if you have to move out to a different area, it's going to be a little bit rough, but, that's why, you have coworkers and everything will help guide you into everything. We accept new graduate students, so, nothing too serious to worry about.
Okay.
Okay, so what interests you about this job?
About this job, I remember my fourth year, so senior year, we took a class in joint mobilization, and it just blew my mind that this was actually like a treatment. I never heard anything about it, and how there is it's science in itself, and it just kind of makes it in awe, and just to specialize in such a thing that seems so simple on the outside. When people are doing it to you, they're like, "Oh, what are you doing?" And you kind of explain it to them. They're like, "Oh, that doesn't seem too hard," but the education requires just to know which way you're doing the force is huge. I think it's also here from the research. You guys have a wide variety. You're not just a mobilization spine clinic. You work with sports, bracing. You do different things like that. So that's where I'm going to gain that knowledge in different fields as well.
Very, very nice. So why are you interested in our specific organization?
Okay. The first one, like I said, from New York, Stayed on the East Coast all of my life, and now out here, it's kind of this is going to be the true test of me as a physical therapist. I'm stepping out of the box. I've never been out here.
Mm-hmm.
I'm not going right to a so-called outpatient because you guys kind of have you do have your outpatient patients, as weird as that sounds, but you also expect a lot from your physical therapist as well. And being kind of a spine clinic, the spine is a mystery no matter how much of an expert you are or you claim to be in it. Every person kind of reacts to a spine injury differently, and I want to, get as much information about the back from the clinicians, from patients I see, and use that to my advantage as well. And I also believe that I can bring a different perspective to the clinic as well, being where I'm from, and being a new grad. There's some things that the other clinicians might not have seen or heard before as well.
Mm-hmm. Okay, so I also know that you were mentioning your soft tissue mobilization class. On top of that, what other experiences have prepared you for this specific job itself?
Okay. So at Ithaca College, I'm not sure if you're aware of the curriculum, but we do 4 total clinicals.
Mm-hmm.
The first one, you're required to do an outpatient and an inpatient,
mm-hmm.
and then the next 2 after that, you can go to whichever clinic that you think is where you want to go in your future. After I did my outpatient and inpatient, I was trying to find focus, so I tried neuro. It kind of wasn't for me, so I tried outpatient for my 4th one. And with each clinic, you're expected to maintain a higher level of responsibility. On the 4th one, we're expected to be able to work as a full-time physical therapist. Completed that as well. While my time at Ithaca College, we have a free PT clinic that the PT students work in with the faculty, and I did that 2 times as well.
Nice. Even though you're a grad student, you do have some clinical experience from what you were just saying. The 4 clinicals that were required in your graduate program. That's honestly really really good.
Mm-hmm.
Okay, so my last and final question is: where do you see yourself in 3 to 5 years?
3 to 5 years. First, simplest answer is I still see myself practicing.
Mm-hmm.
I do plan on staying in the area for a while. I'm not expecting huge raises, anything like that. I know I'm going to have to work for that.
Mm-hmm.
I just want to be a better physical therapist than I was before, especially new grad. And 3 to 5 years from now, with the clinicians you already have, they're amazing. If you're a person who just reads titles, that alone you would come to this clinic. But I can tell just from your website, you have the testimonials. You've won the best clinic in the county for 5 years in a row. So that obviously kind of portrays your clinic, how great it is to work here, and how special the staff is in treating patients and not only being a physical therapist, but being a friend to them. So I see myself here in 3 to 5 years as well, and then just being another name on the wall, but continuing the excellence of this clinic.
Okay. That's all the questions I have. Do you have any questions yourself for me?
Yeah, so the first question is, if I were to become a clinician here at this clinic, what are your expectations for me?
Well, just basing off of what you also said, I know from what you say, you have pretty high expectations of yourself. We also have high expectations. We want our clinicians to be the best. We want them to use their clinical experience and also evidence-based practice to basically, forward their interventions with patients.
Okay.
As a new grad student, of course, we're here to guide you in specialization you want to go to. We're here as a resource for you, but we want you be passionate about your career and want to learn more. So that's pretty much our expectations for you specifically.
Okay. My last question is, what is your continuing ed protocol, just funding wise? If do you have stuff here, different stuff like that?
Definitely. We offer a few select courses here that are provided by staff, but also we do have funding in our corporation where we do have some money on the side for any employee who wants to follow or learn any other continuing ed courses that are outside of what we offer. Of course, it has to be reviewed by management when you put in the request. It's not going to be full coverage. You can see about maybe like half to maybe 3/4 of the funding taken care of by us.
Okay.
Travel expenses, we'll take care of it. But yeah.
Okay. All right. Well, that's all the questions I have for you. So
Okay.
thank
And
you again.
here's my business card.
Okay.
So here you go.
Thank you.
You're welcome.
It froze again. I hit the